This episode of the Bari Chronicles is proudly brought to you by Bariatric Support Australia.
Hi everyone, so we're here with the amazing Dr. Beitner. Thank you so much for joining us. Tash and I have been really looking forward to this.
Hi everyone, thank you so much for having me. I really appreciate the opportunity and thank you for your amazing work with BSA. It's wonderful that patients have a space where they can be supported.
Well, thank you so much, Dr. Beitner. We really do appreciate that. It's very kind. So when it comes to your journey and the process that it's been for you to be where you are today, would you like to just walk us through how you came to be an incredible bariatric surgeon?
Sure. So I'm a bariatric and minimally invasive general surgeon. My journey really started early in my medical career. A number of members of my family struggled with their weight, and when I was working on the bariatric surgery unit at the Alfred, I was first introduced to bariatric surgery, and I saw it as this amazing tool that can make an impactful change in patients' lives. So that is what really sparked my interest. So it took a lot of effort to set my career up in such a way, but basically after I finished medical school, I went to the University of Melbourne. I was an intern at the Alfred and then worked as a junior doctor at Royal Melbourne. I then moved to the States where I did research in bariatric surgery, and I then did my general surgery training, which was called residency, at NYU or New York University, which had a very large bariatric program, which was led by an Australian surgeon actually called George Fielding. After I did that, I did fellowships in bariatric surgery. So I did one at Mount Sinai, and Mount Sinai was the place where Michel Garnier worked, and he was really the surgeon who introduced the sleeve gastrectomy as a standalone operation for bariatric surgery. And then I came back to Australia and I did further fellowships in bariatric surgery. So I worked with George Hopkins in Brisbane and then also with Michael Talbot and that group in Sydney. And then came back to my hometown of Melbourne and have set up my own practice, which is called 360 Surgery.
Oh my goodness.
Wow.
Wow. Yeah. What an incredible roll out there of all of the places that you've studied and all of the incredible input that I'm sure you've had to be where you are today. I mean, congratulations on all of that. I think sometimes we as patients can gloss over just how in-depth the training that our surgeons go through is, and how many years it takes to stand where you're standing, or sit where you're sitting right now. So yeah, that's extremely impressive.
But to be able to cut people open and not get in trouble.
Yes.
It's amazing.
So, I mean, working in the States was such a privilege and also such an incredible opportunity to see how bariatric surgery can be done really well. So both NYU and Mount Sinai have bariatric surgery programs that have been running for 30 or more years. So they're really well established, they're well run, they're well set up, they're well supported, obviously well funded, and they are incredibly high volume. So at NYU, even when I was there, just a while ago now, they were doing 2,400 cases a year, just bariatric surgery. And now it's over 3,000. And as part of their setup, they have a strong focus on having a multidisciplinary team. So one of my goals in setting up my own practice was to bring that level of care, the holistic approach and professionalism to Australia and to help patients in that way.
I love that. I mean, we, as you probably know, Damo and I are just so passionate about the multidisciplinary approach. We believe that, well, I know for myself, it has definitely been so helpful in just setting me up for good health for the long term after my gastric bypass. And I know that Damo didn't really sort of have that same level of support, and it probably would have been a lot easier had he been able to access that, Damo.
Yeah, it would have. So we love talking to surgeons that are, have that whole team behind them, because it really does make such a difference to the patients.
Yeah, absolutely. And so our our practice has a multidisciplinary team behind it. So every member of the team has their own skills, has their own knowledge, has their own expertise, has their own experience and their own way to support you. And when we all bring that to the table, we can really tackle the disease of obesity from multiple angles and help patients get the best outcomes possible.
Amazing. So what happens when a patient rings up and gets an appointment with Dr. Melissa and I'm going in to find out about weight loss surgery? What's the actual process there?
So we do recommend that patients have a GP referral to come and see a specialist, of course, so they get a Medicare rebate. And that rebate is obviously valid not just for the initial consultation, but it's usually valid for a full year if it's coming from a GP, so they can get a rebate for subsequent consultations and surgery if that's in select cases as well. And then they have their first consultation with me, which is very in-depth. I like to spend a lot of time with patients because I think that this is an amazing opportunity to get to know the patient, to understand what their goals are, to understand if they're a suitable candidate for surgery, to go through the options, begin the education process. And of course, at that time, we'll also refer patients to our multidisciplinary team. So all our patients will see a dietitian and psychologist before surgery as well as afterwards.
Yeah, I love that.
And also, I will say that I actually see patients twice before surgery. So it's an initial consultation, but there's also a preoperative consultation. So that's our opportunity to go through all of the tests that they have had, to answer any questions, to do the informed consent. But I do think because this is such an important decision they're making, it shouldn't be rushed. It shouldn't be based off one consultation. So I make sure that I see all my patients twice and at least once needs to be in person.
Wow.
Yeah, I really like that. I think that's amazing. It's really good. You said in the introduction that you'd had some family members that have been impacted with overweight and obesity. Well, I'm assuming that it was sort of something around that. How much would you say watching people that you love go through those challenges has impacted your ability to have empathy for people that are in that position when they come to see you?
I think it's had a huge impact because I've seen firsthand that it's not just about patients' health, it's actually about their quality of life and how they show up in life. So in the case of people who are close to me in my family, like they've really retreated from life as a result of their weight. And I see that so much in my patients too. And having that empathy makes it easier to connect with patients.
Amazing. Yep. I love that because I think you're probably one of the first surgeons that we've spoken to that sort of has that background, and it really means a lot when you're sort of coming from a lived experience point of view as well. And
it's such a scary process, as I have no doubt you're well aware. Ringing up, making that appointment, and then the waiting game and waiting for that appointment. And when that surgeon calls your name and you go into that office, the feeling in the pit of your stomach as somebody that's been in a bigger body. Well, for me, it was my whole life until that point. Just knowing that the person that's sitting on the other side does have an understanding about that is very, very helpful.
Yeah, I often have patients tell me.
Thank you for sharing that.
No problem. I was just going to say that I have patients tell me at the end of their consultation, it wasn't so scary after all.
Yes, I'm sure that you do, because it really is just such an intimidating thing to get the ball rolling, I guess.
Yeah, love it. So what do you think we see, and we get a lot of talk now about the medications, and there seems to be such a big swing, and it's like we sort of wait for the pendulum to come back a bit before we make up our minds on where we sit with that sort of stuff. But there is such a big push with things like Wegovy and all those medications. How do you see that fitting in to what you guys are doing?
Well, I will first say that I have adopted that into my practice. So a couple of years ago, I actually was feeling like my knowledge was quite incomplete around the treatment of obesity, and obesity medications were on the rise. So I undertook actually an additional board certification in obesity medicine. So I'm board certified by the American Board of Obesity Medicine. So I feel very comfortable using that. In terms of where they fit, I think that, the motto or the of IFSO last year, which was integrate, is probably the theme that is going to be driving obesity care in the future, which is, integration of different specialties treating obesity, integration of different healthcare providers, treating patients from a multidisciplinary approach, but also integration of therapies. So it's actually called the medical surgical approach. So as we discussed at IFSO, obesity is a very complex condition that is considered chronic, often progressive and relapsing. So we need to continue to tackle it. So the more tools that we have in our armamentarium, the better. In terms of where it fits with bariatric surgery before or after, there's still only limited data on that, especially using it beforehand. But using it afterwards has been, more extensively studied. We also don't have clear guidelines as to who to treat initially with medications and who needs to have surgery first. It's quite frustrating. We have guidelines regarding the lower limit. So you shouldn't start, obesity medications in patients with a BMI under 27 without comorbidities. Similarly with bariatric surgery, the guidelines are now if you have a BMI over 35, regardless of your comorbidities, you can be considered a candidate. But what about the upper limits? Like, is it appropriate to be starting someone with a BMI of 58 or more on medications first line? I think it's a complex topic. We need to take into consideration what patients' goals, their overall health, and make that decision collaboratively.
It will be an exciting space to watch, I suppose, as the years come and go. And I'm sure that the guidelines will be informed by better research and more research.
Yes. I would love actually for there to be a collaboration between the medical societies and the surgical societies, which I know is a ton of work. And I've previously asked presidents of societies to do this before, to just for us all to come together, kind of like with the cancer guidelines. We do have physicians from multiple specialties coming together to tell us how we treat, colon cancer. We have the radiation oncologists, the oncologists, the surgeons all coming together, but we need to do that with obesity as well. So we have common guidelines.
Yes. Oh, we so agree. Yes. We so agree. We see it so often where people talk about their journey and it is so different, like the treatments, the pre-op, the post-op, all of it is so different from, another person's and another team's. And people get so confused because they'll hear one person talking and they're like, well, that's not what I've been told.
We do also understand that it is such a complex space and that individuals, I suppose we all have our own individual needs and all of that has to be factored in as well. I loved one of the quotes at IFSO. I can't remember it exactly, but I think it was something along the lines of obesity management or weight management is not rocket science. It's much more complicated than that.
100% true.
And we all agree. We really do.
Yeah. And it's like any field, the more you study it, the more you realize there's a lot we don't know.
Yeah. How do you see that there was a big difference between the way like America does it and the way Australia's doing that? I know it could be a bit of a touchy subject.
No, not too touchy. So I think that they've been doing it in the States for a long time. Their healthcare system is set up differently. There are some things that they do very well. So, for example, they have accrediting bodies for bariatric centres. It's called MBSA QUIP, so the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. And they have criteria for how many cases you need to do, what equipment you need to have, what ancillary stuff, and they even have a requirement for a multidisciplinary team in order to be accredited as a bariatric centre. And then they collect the data from these centres to make sure that, people are measuring up.
Wow.
So they also have a much more formalized fellowship process where, if you do a bariatric surgery fellowship, you will be doing like 100% of your clinical time will be doing bariatric surgery, not just the operating, but also coming to clinic and working with the whole team. So there are some things about it that are amazing. I wish that we had some level of accreditation here in Australia. Yeah, I mean, I think that often patients get certain options from surgeons because that's all that the surgeon offers.
Yeah. And I think that's something that we encourage our members when they're looking for a surgeon, is to ask lots of questions. Especially around like revision surgeries and that sort of post-operative care.
Or even, what surgeries do you offer? Do you do gastric bypass? Do you only do gastric sleeve? Make sure that you're asking all of those sorts of questions, because it's just very, very good to know.
Absolutely. You want to have a surgeon who not only knows how to do the operation and select the correct operation for you, but how to manage complications if they do arise.
Right.
Yeah. So how has it been difficult finding those trained people so you can put your team together?
In terms of my multidisciplinary team, so I'm the only bariatric surgeon on my team, and whenever you establish a practice, you do have to do some research to find the appropriate people to work with you. I like that everyone in my team, we have a common goal, and we're all about supporting the patient. So, and it's also important to just acknowledge that the most important member of the team is actually the patient, because we can't do it without the patient. And the patient needs to feel empowered to make use of the incredible tool that is bariatric surgery to really take control of their health. It's kind of like, a football team. Of course, we need all of the players. We also need the captain, and we all need to pull together for the win.
Yeah. With we talk a fair bit about setting the expectations, for after surgery, and I think sometimes as patients we can get a bit of an idea in our head and maybe even come into it with some misconceptions. Do you find that patients are still having those misconceptions, or do you think we're better educated now?
Overall, we're better educated. We have access to the internet. We have access to wonderful resources like the support group, where people can ask questions and see realistically what's going on. But part of the education process is to go through the data, and so I like to give patients all of the information based on research on registries and other information, so that they can make decisions, but also stress that results are for lack of a better term, vary. And your journey is not reflected in the data, because that data is from somebody else's journey.
Yes, I agree with that too. I know my bariatric surgeon was fantastic. He gave me all of the data. It was very factual, and I left the appointment thinking, my goodness, I thought that maybe I would get to a lower weight than what he sort of he didn't ever give me a goal. He just set a range of what would be expected. My personal result far exceeded those expectations, but it really does vary, doesn't it? And there really isn't a way, I don't think that there is a way to predict or tell just how things will pan out.
No, we don't currently have a good way to predict or tell how things are going to pan out. We have general rules of thumb. So in patients who have more severe obesity, we want to use procedures that you might call more aggressive. They have both a restrictive and maladaptive component to them, such as different types of gastric bypass. Patients with less weight to lose might do a sleeve.
I think that's great, being able to, go to a surgeon who can take all that into account and help guide the decision. I know because my surgery was over 10 years ago, and it was sort of really left up to me, what do you want to have? And, my surgeon sort of gave me the options, but I didn't really understand the real differences between a sleeve and a gastric bypass. And I guess there's more information now as well. But if I had have understood better back then yeah, I would have asked more questions and hopefully not ended up with the constant reflux that I've got at the moment. Yeah, it's really good, and I think it's nice for patients to be able to, have some control over what they're getting, but also understand why they're getting it.
Yes, 100%.
So over the course of your career, what advancements in surgical techniques have you
It's constantly changing, and that's what makes it so interesting. So even in my short career, I mean, we have gone from the band to the sleeve to the SADI. There are more and more minimally invasive endoscopic options available and new things on the horizon, which is so exciting, like new techniques to do surgery. So I don't know if you have heard about like magnetic anastomosis, but that's definitely on the horizon, and that's what makes bariatric surgery so interesting.
Yeah, I mean, I can well imagine, and I often wonder when they first started doing bands all those years ago, or even when they first stomach stapled all those years ago, if they even could have imagined that one day in the future robots would start playing a role in these surgical procedures. What do you see the future being in that type of space, the robotic stuff, the minimally invasive techniques, and all of that kind of thing? Do you think that we're going to see an increase in those?
It's so controversial. I should clarify, however, that robotic surgery it's robot assisted laparoscopic surgery. Yes. So it's really the same techniques for doing the operations, just using slightly different instruments. But like all technologies, they're going to continue to evolve and get better. Whether or not the procedures change, well, we're always trying to reinvent the wheel. And so there will be some degree of going back to procedures we've done previously with some modification, but there are new procedures and new technologies on the horizon, like these magnetic anastomoses.
Yeah, that's just it's very fascinating to me. Walking around, if so, watching people play with all of
the little
robot things and all of that sort of stuff. I can just imagine how that must be for surgeons to look at those things and start to imagine, oh well, I can see how that might factor into a surgery or whatever, or make things better and safer, I suppose, is what you would always use to measure.
No, I think it'd be overwhelming. Hey, like I think you spend all these years at university and stuff learning how to do these procedures, and then someone comes along and says, here, we're changing it, you need to do this.
Yeah, I think for some surgeons that would be the case, but I think as a surgeon in the current era, you need to have a growth mindset and be open to new technologies. No doubt, by the end of my career, everything that I learned at the beginning will be completely obsolete. And yeah, of course, that's just the nature of evolution in medicine. I mean, we used to do bloodletting as a treatment for a variety of different things.
Yeah, that's exactly right. Yeah. Isn't it interesting though when you have a growth mindset and you can come at something that is as important as the field of medicine and understand that, okay, well, what I know today will look very different to what I will know in 20 years' time. But I'm excited to know it.
Yeah, that's the right attitude to have.
Yeah, I think that is amazing. And I honestly, because Tash and I have been asked to be on a steering committee with Monash, working with the
Bariatric Surgery Registry.
The registry. And even that is just so exciting to be asked to, put our skills into something that is going to help people. And we don't even know where it's actually going to go, but we're on this bus going somewhere, and it's exciting.
We're just very excited for the data that's being collected to start to inform better other choices. Just very, very excited to watch watch this particular field evolve. I mean, obviously we're very passionate about it ourselves, and
see such a dramatic difference at times that people are having in their lives. And like you said before, it's not just about the weight loss or the health goals, it's about the quality of life. And people, so often we'll hear from one of our members and they're so excited because, they've just found out that they're pregnant and, they hadn't been able to conceive before that. And, so many exciting things for people, and it is just so life-changing.
Absolutely.
Do you have any, I guess, favourite stories that you might have seen, something that really stuck out to you?
Well, look, probably the one that I think about the most often is actually from my personal life, when a member of my family had bariatric surgery. I was quite young, living at home, and I came home from wherever I was that day, and I checked the letterbox and it was empty. And I'm like, that's unusual that there was no mail, because I know that the person usually at home would never go down the stairs, would never go outside to pick up the mail. But when I came home and I saw that it was on the kitchen table, and I know that no one else had been home, that's when I knew things had changed.
Thank you for sharing that. Yeah.
I know it's small, but it's
No.
just representative of how someone is more energetic, more mobile, can participate in just something like bringing the letter.
Yeah. Oh, look, I can actually really, really relate to that myself. Just in my willingness to go outside and pick up like the mail out of the letterbox. I never used to do that either, ever, before my bariatric surgery, because it was just another effort, or I'd wait until I had to go outside near it because I was going out. I would never just go and do that because it hurt. It was such an effort. So it's a very, very powerful thing to highlight, and it is representative of those of us that have been doing life in a bigger body, and just how those small, well, they seem small to other people, but they're not small to us.
I remember it was after I'd lost the majority of my weight, and I'd actually started getting out more, and at that point we were living on the Sunshine Coast, and we came down to Geelong for a week, and was walking along the beach with some of Tasha's boys, and there was this rock wall leading up to a cave along the beach, and there's a photo of me climbing the wall, and the photo is like at my back, and I look at that picture and it's like, I would never have even gone onto the beach.
And the delight and the squealing from my kids.
Seeing Uncle Dame.
Uncle Dame is climbing. Uncle Dame is climbing. Like, they were just so excited and couldn't believe it because Uncle Dame was climbing, was participating in something physical with them. Yeah, it's a memory that sticks out to me as well.
Fantastic.
Yeah.
It's
very,
amazing.
very
So
life-changing.
the life-changing things that you guys are doing is just incredible, and I'm just so glad that there are more clinics like 360 that have that, I guess, whole person attitude, and you're treating the whole person, not just one particular little thing.
And that's why we call it 360, because it's like a 360-degree approach to patient care. That's what I was going for anyhow.
Yeah.
Well, I love it.
I think you nailed it with that.
So what are your goals for the future of your particular practice? What are you to achieve?
Wow. So, as a practice in its infancy, obviously I hope to grow and continue to make a difference in patients' lives, but also to bring other surgeons and clinicians into our practice so that, we can really do that 360-degree approach. So, there are I myself do some of the weight loss medications, and another physician in our group also does, but I think that will become more and more common. And, a lot of people say that the use of weight loss medications is actually bringing awareness to the problem of obesity and will eventually drive an increase in bariatric surgery in the future. So my personal goals are just to continue to keep up to date with the data and hopefully upskill in some of the newer techniques that are becoming available in the future.
That's so exciting. I cannot wait to watch this evolve for you.
Thank you so much.
Really.
Yeah, it's going to be amazing. And having that attitude, I think, is such a big part of it. And I think that sort of the enthusiasm it rubs off on other people, which is really good.
Good.
So
I'm certainly passionate about it.
We can tell, and we love it.
Good.
Thank you so much for chatting with us today.
No problem at all. I appreciate the opportunity, and thank you again.